Would it surprise you to know that 75% up to 95% of all women that have had the O-shot treatment, they have reported noticeable difference in their arousal and orgasm intensity? Come talk nerdy with me. My name is Dawn Mugel. I'm a board-certified nurse practitioner specializing in aesthetics and wellness. Let's talk about the O-shot. What is it? So think of, let's say you're having painful intercourse or vaginal dryness or urinary incontinence, stress incontinence. All these things may be improved by helping to promote healthy tissue, oxygenation and regeneration in the area. You'd come in and we would draw your blood in 1 or 2 vials here that you can see depending on what it is that we're trying to treat. And then we spin those out in a centrifuge and we extract your platelet rich plasma. And then that is injected directly into the area that we're treating. So your injection sites would be into the clitoris along with the vaginal canal. Now, before that makes anybody panic thinking about a needle in those areas, just know that you'll be completely numb before the treatment starts. So it's actually very comfortable throughout the treatment. So what are the benefits of PRP? Our body is super smart and we were made to heal ourselves. So we are just extracting your platelet-rich plasma to inject that back into the area to promote healing and foster regeneration of tissue and cells in the area. So what can you expect after the treatment? Most women report after a few days post-treatment feeling an increase in sensation and an improvement in arousal and lubrication. But the full effects of this treatment could take upwards of 3 months before you see its full effect. Downtime for this treatment, you really just want to keep the area clean for a full 24 to 48 hours afterwards, and no intercourse or anything inserted, certainly not any perfumes or lotions or douching or anything like that. After 48 hours, those puncture marks that were placed will be completely closed, and then you can resume your normal activity. So for this treatment, obviously a consultation is recommended because it depends on what it is that we're trying to treat, and that will depend on how many treatments would be recommended. You could anticipate anywhere from 1 treatment to 3 treatments. If there's multiple treatments, they're about 4 to 6 weeks apart. Time frame that you could expect to see results, like I said, usually those have been reported within about a few days after treatment, and they can last anywhere for a few months up to a few years after getting treatment. It really is very patient dependent. I think there's such a stigma around sexual health, not just for men, but also for women, that it's uncomfortable to talk about, it's uncomfortable to share if you're having pain during intercourse or arousal issues, or you can't orgasm, and it's such a sensitive subject to talk about with your partner. I really just want everyone to know that it is okay to talk about it, and please come and talk to me about it, because I am happy to not only explain what's going on, but all your treatment options. Don't suffer in silence, because there are a lot of choices for you. So come in, let's chat about it, and be sure to stay tuned for my next video, which is going to be all things PDO threads. Until next time, come talk nerdy with me.